Hey, SJ here from live from the Rehab Hub. So I'm jumping on to maybe talk a little bit about what clinical Pilates is. So right now I'm in the semi-private room in the Rehab Hub in our Kinning Park studio and clinic in Glasgow. And within here we offer, if you've ever looked at the timetable, we offer classes that say clinical Pilates, semi-private classes. And I just wanted to kind of discuss a little bit about what happens in those sessions. So you can see in here that, you probably don't see fully, but I'm sitting on a reformer just now, and there's a few other ones in here. So there's 5 reformers in here. We also have over there, you'll see this is a ladder barrel, and then just behind me here, you can, there is the Windows chair. And we can see on these machines, so see if you look there, it's got like an extra tower attachment. So it's got this big metal bar around where the reformer is. Now, something that's also different in this room is that it's got this full length mat on it. Now, these full length mats do come off, which I'll show you. So underneath here, you can lift these off, and underneath here is the reformer bed as well. So in this room, these are all reformers as well as the tower, as we call it. And we use this for our semi-private sessions. And one of those classes that we do is called Clinical Pilates. Clinical Pilates is probably as it sounds, it is essentially a smaller number of people who've possibly got some health concerns. They've possibly got back pain, hip pain, knee pain. They've got some sort of musculoskeletal condition that they're maybe needing a wee bit more attention or more help with. Next door, Sarah's actually teaching a class just now, and there's 10 people in those classes through there. Now, those classes are, excellent. We've got the classic classes and the tone classes, and they're excellent for the majority of our clients coming in, but they wouldn't be suitable to everybody, especially if you've got more care requirements, whether that be some sort of injury, wherever that may be. So the clinical sessions, it's usually a healthcare professional that will take them, whether that be a physio or an MSK podiatrist, and they tend to be more injury focused. We use all of the attachments on the machines. We use the props, things like circles. I'll show you what I mean. We might use yoga or Pilates wheels, I suppose I should say, these sorts of things, balls, and we also use the spine correctors. I'll show you some of these. So these are these big arc-looking things. So we use a lot of things like this. So we've got a wee bit more scope to do things, play a little bit more, I suppose, and adapt things to your requirements more than a large group class. The types of people that come into here, as I said, usually have injuries, and usually prior to coming into this class, what they would have done is they would have booked the beginner's course, but usually they would have booked that with a full MSK assessment, so a gait and posture assessment first. So make sure you check out, if you're interested in doing or starting a Pilates or a rehab journey with us, that you check that out. That's definitely your starting point, would be to book the beginner's course with the gait and posture assessment. And that's especially important for those of you watching this who have got injuries, who've got, it can really be anything. A lot of people say, I've got shoulder pain, back pain, knee pain, hip pain. If that's something that doesn't massively concern you, and you just think, maybe you're seeing somebody else, like a physio somewhere else, and you just want to come to us for the Pilates, it's no problem to do that. But what I can say to you is that the patients, the clients that book in and go through that kind of gait and posture and get that analysis and then get a structured plan, it basically joins things up better, because we know fully what is going on with you and we can then best help you. So it's definitely the best way to move forwards, I suppose. So make sure you check that out. That's how you would get started. But I wanted to just show you in this room, because it's not one of the rooms that we film in quite a lot, because it's not, I suppose, as beautiful as a room next door. It's a lot, that room next door is much, it's much more of a, I suppose, a aesthetically pleasing room. This one's a wee bit more of a normal looking kind of square room, isn't it? So it's got the 5 machines. I'll kind of spin this round and give you a wee look around so you can see here. So this is kind of what it looks like. It's quite a nice wee cosy. We've usually got some sort of kind of background thing going on the TV over here. Sometimes we'll live stream things, zooming classes out and things, and for our replay sessions. I should say this is also the room that our clients use the replays. So if we look over here, you can see there's little iPad stations, and many of our clients who come to us, like you would a gym, come in, they pick their little iPad station up, they come into this room, they choose what type of reformer or tower workout they want to do, and they do their workout in this room as well. And that's something that you can do once you've a wee bit more experienced. So usually we say to people, once you've done about 10 classes with us, then think about doing replay sessions. Not before that, just, I mean, most people wouldn't know what to do on these things. So just for safety. What a lot of our clients have done, which is pretty cool, is they have commissioned their own rehab to be filmed for them. So we have got some people where we film them. We've created a program for them based on their injury. We've filmed it with them. So we've just filmed it live, and then we put it onto the replay session. So it means when they come in, they can just do their own rehab that we've filmed for them. So it's pretty cool. So we can do lots of different things like that. First stage for starting with is the beginner's course. That is your first protocol. If you have an injury, book the gait and posture assessment, so book the whole package. If you don't have an injury and you're just looking to do reformer Pilates, then you just book the standard beginner's course. Price-wise, you're £110 for the beginner's course. That gets you 2 one-to-one sessions and 4 classes, or 4 class credits, I should say. And then the gait and posture, I believe, now don't quote me on this, I think it's about £250 or somewhere around that. That gets you your full 3D gait analysis, posture assessment, 2 one-to-ones, and 4 class credits. So it's just got this whole big assessment and rehab kind of plan behind it, whereas those with no injuries don't need to go through that. So that hopefully answers some of your questions, shows you a little bit about some of the other rooms that we have in here in the Rehab Hub. And if you've any questions, please, as ever, just comment, pop us an email, the phone number will be on this. I'll be honest, I don't know the phone number off by heart, so I'll not tell you what the number is. Let me have a wee look. That'll be on the website. It is 0141 363 0306. Really should learn that off the heart, shouldn't I? But I'll sign out because I have another patient coming in. But I hope that's given you a little bit of a behind the scenes. We like to be a wee bit more of a kind of open book in here. What you see is what you get. And you can see that we're fairly normal. As normal as normal as can be. All right, I'll sign out. See you all later.